Hi, I'm Dr. Shreya Iyengar Patel, your go-to gynecologist and fertility specialist at Balaji Horizon Women's Hospital. IVF is very challenging both emotionally as well as monetarily. Hence, I want you to know the facts before you go ahead for this procedure. Today, we'll be discussing about this wonderful paper which came out on the 5th of June in this year, Infertility, Sterility, which tells us how many mature oocytes are required for a euploid embryo having normal number of chromosomes, and it correlates its number with age. This was a retrospective study conducted on 2660 IVF cycles where PGTA analysis was done for the embryos, and it was a study which was spanned over 5 years from 2017 right up to 2022. It concluded that at 35 the chances of getting an abnormal embryo is around 20%. The chances at less than 35 is significantly lower. Only 9% abnormal embryos are there. Beyond 40, percentage of abnormal embryos increases right up to 58%, and beyond 44 years this is almost 90%. That is, almost 90% of the embryos which form are abnormal at age of 44 and beyond. IVF consultants all over the world refrain from doing IVF cycles beyond the age of 45 because the chances of getting a good embryo are very meager. So first of all, for those who are new to these terminologies, I would like to explain what a euploid embryo is. A euploid embryo is an embryo which has normal number of chromosomes. So whenever there is a fertilization of eggs, there is a chance that the number of chromosomes in the fertilized embryo may either be more or less due to various reasons like deletion of a chromosome or duplication of a chromosome, or sometimes an additional chromosome is there, and this leads to various numerical anomalies in the number of chromosomes. And for example, you have a very common syndrome known as Down syndrome, which happens because of a trisomy or an excessive number of chromosome in a chromosome number 21. Then there is Edward and Patau, which is due to trisomy in chromosome number 18 and 13. Similarly, there are other abnormalities which can happen in the genetic structure of the chromosome. Various tests are available which may rule them out. So we have tests like pre-implantation genetic testing, which is done by trophectoderm biopsy in the embryo, and around 5 to 8 cells are collected and studied for their chromosomal and genetic structure. In PGTA, which is pre-implantation genetic testing for aneuploidy, only numerical abnormalities in the chromosome number are detected. For example, if you can detect if there is a trisomy in 21 causing Down syndrome. There is another test available which is PGTM, which is pre-implantation genetic testing for monogenic disorders. Lots of genetic abnormalities can be pointed out to a single gene, and this can be studied by this test. You have syndromes like thalassemia, like Huntington's chorea, spinal muscular dystrophy, wherein either of the partner has this gene abnormality, and hence they want their embryos to be tested. PGTM can detect very common abnormalities like sickle cell anemia, like cystic fibrosis, which are commonly seen in general population. Non-invasive pre-implantation genetic testing is also available nowadays, wherein the culture medium in which these embryos have been kept, it is studied because the embryos tend to discharge their genetic material into this culture media. The blastocele fluid may also be taken for analysis. So you can run the various tests for chromosomes and genes on this fluid, and detect certain abnormalities. Are these tests recommended for everyone? No. It is not necessary for every couple undergoing IVF to undergo these testings. Those who have had recurrent pregnancy losses, or those who are already having affected people in their family, or those who themselves are suffering from some disease, may vouch for these kind of testing. Those females who are undergoing IVF at an elderly age may also opt for genetic testing to have a good euploid embryo. All the good grade embryos may not be euploid. All euploid embryo may not result into a successful pregnancy. The rates of pregnancy, even with the healthiest euploid embryo, are around 50 to 65% in a single embryo transfer. After 2 embryo transfer, the chances of successful pregnancy is around 75%. And after 3 embryo transfers, the chances of success is around 80 to 90%. So, concluding, I would just like to say that it may require more effort to conceive. There is no 100% guarantee of pregnancy in any procedure till date. As you can see that an elder age, the difficulties in getting a good embryo increases. Hence, it's always advisable to plan early. Best fertility outcomes are observed between 20 to 30 years of age. But at least try and plan a pregnancy before 35 years of age. This study concluded that the number of oocytes required for attaining one euploid embryo increased as the age increased, and the number of treatment cycles required to have one euploid embryo at an elder age is more compared to that at a younger age. If you are not planning any pregnancy or conception before 35, at least give a thought to egg preservation or embryo preservation. Every patient and every case is different, so please sit with your doctor and understand your case thoroughly.